Good morning, doctors and friends. We're from SGD 2 and today we're going to explain about meniscus injury. Here's the list of all of our members, and we're going to start with an introduction. So meniscus is a very important disc in the knee as it helps with shock absorption and load transmission. It is a part of the human body and is made out of fibers and cartilage, so it can also get injured. Meniscus injury is actually not that common in general population, but the incidence rate in highly active individuals is 1,200 times higher than those in general population. Those at risk including military population and young athletes. This is mainly due to the requirements of frequent squatting, kneeling, and twisting that they face daily. However, unlike ankle sprain, not many people actually know about meniscus injury. If it is left undiagnosed or untreated, meniscus injury can transform into something serious.
Injury to the meniscus, or also known as meniscus tear or meniscus injury, is a common tragedy happen from athletic and daily activities. Menisci are C-shaped or semicircular fibrocartilaginous structures located between the tibia and femur bone. It has a role in increasing the congruence of articulating surface and also supports the stability of the knee joints. It also has a main role as a shock absorbance. The tear commonly occurs in the inner zones in which the menisci are thinner, and the injury can happen from a result of a forceful twist to the knee or also from a degenerative process.
So now I'm going to talk about the epidemiology of meniscular injuries. So it's commonly seen in athletes as the result of their exercises. Approximately 15% of sport injuries are meniscular injuries. Some of it are partial, some of it are total of medial, lateral, or bilateral meniscular injury, but most of them are medial meniscular injuries. Of course, it happens more to men rather than women because of their types of sport. And it happened mostly in our productive age. For example, age 21 to 30 years old for men and 11 to 19 years old for women. Next.
The meniscus can be torn during activities that cause direct contact or pressure from a forced twist or rotation. Many athletes are at risk for a meniscus tear. Even kneeling, deep squatting, or lifting something heavy can sometimes lead to a torn meniscus. In older adults, degenerative changes of the knee can contribute to a torn meniscus with little to no trauma.
Risk factors of meniscus injury can be divided into two types, which are modifiable and non-modifiable risk. The first modifiable risk is activity level. A person with higher activity level, such as athletes or soldiers, has an increased rate of meniscus tears. Meanwhile, a person with lower activity level associated with medial meniscus posterior root tears. Another modifiable risk is body mass index. A person with a body mass index greater than 25 kg per square meters shows an increase in mechanical meniscus damage that leads to a change condition of knee loading. There are three non-modifiable risks of meniscus injury. The first one is age. As age increases, there's an increased incidence of meniscal abnormalities and degenerative tears. The second one is gender. Men are associated with more meniscus injury than women, but women have a higher risk for medial meniscus posterior root tears. The last one are anatomical factors, including posterior tibial slope, medial meniscal slope, biconcave medial tibial plateau, and patella malalignment. Thank you. Next.
A variety of signs can be caused by meniscal injuries, including distress augmenting to the joint line, swelling, clicking, and the knee's classic giving away. Joint locking is another common complaint, where the injured individual is unable to completely straighten the knee. Compared to females, symptoms are most frequently found in males, with up to 80% of all meniscal tears. Amounting to the discomfort, several patients have also reported waking up from the sleep. Often, a person with a torn meniscus may recall a particular activity that caused the injury. A tear of the meniscus is typically accompanied by a fracture affecting the knee rotations since it is slightly bent. Some maneuvers also exacerbate the pain after the injury, for example, getting out of a car. During the injury, a sliding or a popping feeling may also be encountered by the person.
So the next is diagnosis. In taking the diagnosis of meniscus injury, it takes several tests. The first is history taking. This could be the first step of clinical tests for taking diagnosis for meniscus injury. Usually, the patient will give a complaint in the form of symptoms experienced, and the type and severity of meniscus injury has nothing to do with the symptoms. And then the second is physical examination, and the first task is McMurray test. This maneuver elicits knee pain or reproduces a click in the presence of meniscus injury, and if the result is positive, usually there will be a pop or click sounds in the test. And the second is uplay test. In this uplay test, the patient will be placed in a pronation position, and the knee to be tested will be bent to 90 degrees. And the test is positive if there is a pain with compression and internal or external rotation. And if the patient experiences pain above the medial aspect of the knee, this indicates a medial meniscular injury. And alternatively, if the patient experiences pain above the lateral aspect of the knee, this indicates a lateral meniscular injury. And then the third is imaging test, and the first test is in MRI. In MRI, the magnetic field is used to take some pictures of the patient's knee, and an MRI will take pictures of cartilage and ligaments to determine if there is a meniscus injury. And the last is arthroscopy. With arthroscopy, small incisions or pieces are made near the knee. An arthroscope is a thin and flexible fiber optic device that can be inserted through an incision. In the arthroscope, there is a small light and a camera, and surgical instruments can be transferred through an arthroscope or through an additional incisions in the patient's knee.
For meniscus injury, we can use two options of treatment, such as non-operative treatment and operative treatment. First is non-operative treatment. Home physical therapy for meniscus injury for initial stage is RICE, rest, ice compression and elevation, and use non-steroidal anti-inflammatory drugs. This physical therapy program's goals to minimize the effusion, normalize gait and pain-free range of motion, and prevent muscular atrophy. Second is operative. First is meniscectomy. Partial meniscectomy with arthroscopy refers in case of symptomatic meniscus injuries. The goal of the surgery is to remove fragments of the meniscus that stick out into joint. These fragments can interfere joint movement and cause your knee to lock. Second is meniscus repair. There are three main techniques in meniscal repair, namely inside out, outside in, and all inside. The arthroscopy assisted inside out is the gold standard, in which this technique places the tear, then performs fixation of the suture across from the intra-articular area by using a special cannula to the safe extracapsular area above the capsule with posterolateral or posteromedian incision. Second is outside in. Technique is rarely used. Passing stitches are passed through two spinal needles that were previously passed from the meniscal axis to meniscal body along the meniscal tear. Third is the all-inside technique using flexible stitch-based device. This technique has become widely used for most meniscus tears because there are several advantages such as avoidance of accessory opening and portal incisions, easy application, use of implants that can be absorbed biologically, and risk which is relatively smaller for injury to the posterior neurovascular structure. However, its use is limited to anterior meniscal tears.
The next one is meniscal reconstruction. So there are two procedures, namely meniscal scaffold and MAT or meniscal allograft transplantation. Meniscal scaffold, which has very porous, cell-free, and biodegradable properties, this method is used to fill defects in a meniscus that were previously partially resected to develop meniscal tissue by allowing migration and growth of vascular channels and precursor cell into the scaffold. MAT is procedure to revise ACL reconstruction to help joint stability simultaneously when meniscus deficiency is believed to be the cause of failure, or as a procedure to repair articulate cartilage together in the meniscus deficiency compartment. The next one is postoperative. For partial meniscectomy, patients should train with stationary cycling or straight leg raising on the first postoperative day. There are three main points of rehabilitation in meniscus repair, which consist of knee motion with bearing and return to the spot.
For
For the complications, in patients with untreated tears, enlargement of the tear and arthrosis are common. In patients who are status post-partial meniscectomy, complication that can occur is arthrosis. Reported complication rates for arthroscopic meniscectomy extend from 0.5 to 1.7%, and this can happen intraoperatively or postoperatively. Intraoperative complication includes anesthetic issues, articular cartilage damage, vessel or nerve damage, or instrument failure. Postoperative complication includes anesthetic concern, thrombophlebitis, hemarthrosis, infection, stiffness, persistent pain, effusion, or synovitis. The list of complications is the same as that for meniscectomies, with a more prominent concern for neurovascular damage. Also, failure to heal or meniscal re-injury can occur.
So, this is the case. Meniscus tears are common injuries seen during sports. The main symptom of meniscal tear is knee pain and accompanied by other symptoms such as clicking and snapping. Can also occur especially with the sliding flap of the tear of the bucket handle. Menisci are knee structures that play an important role in load transmission, lubrication, and joint stability. So, when meniscal injuries occur, they significantly affect knee function. Treatment was undertaken to retain as much meniscal tissue as possible after reduction of the displaced flap, but improvement was not achieved due to a tear of the avascular zone of the meniscus. Based on the result of MRI, a limited partial mastectomy can be performed with a balanced edge. This is followed rehabilitation by allowing the patient to resume exercise once postoperatively knee pain has subsided, and as soon as he regains good quadricep and hamstring control.
The conclusion, human bodies have a total of 4 menisci, which one leg contains 2 menisci discs. It is located on the articular surface of tibia plateau. Meniscus injury, also known as meniscus tear. The injury is typically a result of a forceful twist to the knee or a degenerative process. For the epidemiology of meniscus injuries are approximately 15% of all cases sport injuries. For the symptoms, there are various signs such as distress augmenting to the joint line, swelling, clicking, and the knees classic giving away. To diagnose meniscus injury, it needs several tests such as history taking, physical examination like McMurray test, a play test, and imaging tests such as MRI and arthroscopy. For the treatment, we can use non-operative treatment like RICE and NSAID, or operative treatment such as meniscectomy, meniscal repair, and meniscal reconstruction. Next.
For partial meniscectomy, patients should train with stationary cycling or straight leg racing on the first post-operative day. The etiology of this disease is caused by activities such as sudden pivot or turn, deep squatting or heavy lifting that cause direct contact or pressure from a forced twist or rotation. The risk factors for meniscus injury are two kinds. Firstly, there are modifiable risk factors such as increased activity levels and body mass index. Then there are non-modifiable risk factors such as age, gender, and anatomy. The intraoperative complications of meniscus injury are anesthetic issues, articular cartilage damage, vessel or nerve damage, or instrument failure. The post-operative complications for meniscus injury are anesthetic concerns, thrombophlebitis, hemarthrosis, infection, stiffness, persistent pain, effusion, or synovitis. That's all for our student project presentation. Thank you for listening.